Let me take you back to my childhood. Elementary school, Logan School. We used to take little paper balls, load them into a tube, and blow them out. A primitive blowpipe. Why does this come to my mind? Because in South America, natives have long used blowpipes to hunt small animals. And those blowpipes were not loaded with little paper balls, they were loaded with darts that were tipped with a poison called curare. Why am I talking about that? Because if you pick up a textbook of medicine in which surgery or anesthesiology is discussed, you'll find that it's divided into two eras, so-called pre-Harold Griffith and post-Harold Griffith. Who was Harold Griffith? Harold Griffith was a Montreal surgeon trained at McGill University, who in 1942 introduced curare into surgery. This was a breakthrough. Now, anesthetics had been introduced 100 years earlier, but surgeons discovered that they would cut into an abdomen and the abdomen would go into spasm. They didn't like that. So they were looking for substances that could temporarily paralyze muscles so that they could carry on surgery, and also to intubate patients who would not then have reflexes that would prevent the intubation. Well, historically, it turns out that curare can do that. It's a paralytic poison. It was introduced into Europe in the 18th century by South American explorers who brought it back, and some early experiments done on a donkey. I don't have a donkey. He'll have to do. Injection of the chemical, the curare, into a donkey would paralyze the animal, basically totally, but incredibly, it would recover after, as long as it had air pumped into its lungs while it was out. Well, this came to the attention of Dr. Harold Griffith, and he thought that this would be just the thing to try in surgery. And he tried it. Now, this was before ethics committees, and he didn't look for any approval. Back in those days, they could just try stuff, and it worked. Injection of a small amount of this arrow poison into patients during surgery paralyzed them long enough to allow the surgeon to do their job properly. It's an amazing story. All the way from the jungle to the operating room. Who would have ever thought that that little arrow poison would turn into a miracle product in the operating room? Of course, today, chemists have come up with analogs of it, and we use synthetic derivatives, not the original extract of curare, but still, it was the curare that laid the foundation. And that, as they say, is history.